I'd like to thank you all for joining us today for our CHEC Healthcare Program webinar. My name is Alexander Ayala. I'm with the California Hispanic Chambers of Commerce. I'm the Membership Services Manager over here at the Chamber. And this presentation is really for you, our members, and for your employees. And we really want to make sure you guys are educated on it and see if it works out for you. I want to first of all thank the Antelope Valley Hispanic Chamber of Commerce for partnering with us on this one. I'm sure Sylvia's in here somewhere. Thank you, Sylvia. Thank you guys for pushing it out here. I know this is a statewide webinar, but I know they said, hey, you know what, we want to push this out. We want to help. And we think our people should really come in and take a look at this. And if you are a chamber leader and you think you want to do one for your chamber as well, please contact us here at the office. Our number is 916-444-2221. And I can get our good friends, Catherine and Ed here to come show up. And hopefully it sounds like now we can all start meeting in person here in California. So that's wonderful news. Just a few housekeeping things, folks. If you look at the bottom of your screen, you will see a Q&A function. If you have any questions, please answer them. We will take the time to, if we have enough leeway, we'll try and answer as much as we can. I know Katie and Ed will also be putting their contact information towards the end there. So we'll be able to, if we don't get to your question, we can absolutely connect you with them. Once again, thank you all for joining us. And with that, let me turn it over. Ed and Katie, go ahead.
Good afternoon, everybody. My name is Ed Hanley. I'm the founder of Apogee Health Members, LLC, and we developed and we maintain the www.chcchealth.net site, which features healthcare programs that are designed and are available exclusively to members of the California Hispanic Chambers of Commerce. And we, of course, and we have our California administrator representative with us, Catherine Gutierrez Schultz, but just want to start out today by thanking the CHCC and their president, Julian Canete. And they really have put together a great program for you members that can help with your healthcare expenses and your healthcare benefits. And we want to give you the 30,000-foot overview today. So thanks to all of you for taking a little bit of your time, your busy schedule on reopening day in California. I'm in Chicago, so but congratulations for that as well. Over the past 50 or 60 years in this country, we have operated on one model of healthcare programs, and that is the group model. And it really has not worked. We have the greatest healthcare system in the world. We have hospitals that are up to date. We have doctors. We have everything. But it's just become more and more and more expensive to the point where, a lot of people just can't afford it. And a lot of employers can't afford to offer it to their employees. And, that's really kind of a shame. So with the vision and the foresight of the CHCC, we developed what we think is the answer. I'll tell you the truth, is the answer. And I'm going to turn it over to Kate here in a moment to describe it to you. But let me just say at the beginning, we're not going to be able to answer all your questions today in 30 minutes or 45 minutes. So I encourage you, if you have any interest at all, Kate is always there to answer questions, do comparisons, follow up with you, and she's great to work with. So, because this is a unique program that we've put together. All right. Well, with that, I want to introduce Catherine Gutierrez Schultz, who's our California representative, and Kate is going to talk to you about why this is unique. So, Kate, I'm going to move it forward and turn it over to you.
Well, good afternoon, everyone. And I'm sorry you can't see me very well. My video is a little bit fuzzy today. But as Ed mentioned, my name is Catherine Gutierrez Schultz, and I am the California Program Administrator for chcchealth.net. And today we are going to describe a new way of looking at healthcare. We realize this does involve a lot of information. So just keep that in mind as we go through. And so here, how does the CCC Health Net programs work? So we're going to walk through the program and how it works for you. And so we're going to go through who is eligible, what the requirements are to enroll, the California individual mandate, and if this does apply, what makes this program unique, and how it works and how it compares to other plans out on the market. And we're also going to talk about where you can get more information. All right, next slide.
I'm trying. Okay. So Kate, you mentioned we're going to talk about who's eligible to enroll. So why don't we start right there?
All right, so this unique benefit is only offered to our CHCC members and affiliates. So there's no other Chamber of Commerce in the state of California that is offering a healthcare program for their businesses as unique and affordable as the chcchealth.net. So there's no minimum employee requirements. Small businesses and employers are encouraged to participate. This is not group coverage. It is individual. So employees can enroll on their own. The employer just needs to sponsor. We also have year-round enrollment for this plan. And so again, I can't stress enough as we go through this, remember this coverage is for individuals that belong to a group and it's not group coverage. But you, as the employer, you do opt in to offer it to your employees, and you can contribute or you can just give it to them as an option, as an alternative option. But you can contribute as well.
And so you just mentioned that, you mentioned two things actually that are interesting. Number one, you mentioned the California individual mandate, and then you mentioned the employer opt-in, the employer sponsor. How do those two things fit together?
All right, so starting January 2020 in California, the individual mandate did come back, and so we are required to have health insurance, and this program does meet the individual mandate and ACA.
Okay, very good. That's when the employer sponsors it, not that the employer has to pay for it, right?
Correct.
Okay. All right. Now, at the beginning of the program, I might have mentioned, I'm not sure that I did, but what we did is we have found programs that split healthcare into two components, and they're kind of common sense components, really. The first one is for outpatient services, and the second one is for catastrophic and inpatient services. Outpatient is doctor's offices and the like. Inpatient is hospitals. So Kate, can you talk for a minute about component one of the chcchealth.net programs?
Yes, so as Ed mentioned, we divided the healthcare services into two components. And the first is our healthcare category. It's your everyday routine outpatient medical services for doctor's office, specialists, visits, x-rays, labs, urgent care, things that are done outside the hospital. And we have 3 plans to choose from. There are no waiting periods, no deductible, and again, day 1 coverage. No pre-existing restrictions for this plan. There is discount only, however, for inpatient hospital charges on the component 1. There are low premiums and a long list of additional coverages. We have prescription plans. We actually have 3 prescription plans for each of our essential plans. We also have dental, vision, hearing, telemedicine, which is 365, 24/7, you're able to call. Same with telebehavioral health. That's a new benefit we have, and that you can also use 365 and 24/7 as well. We have chiropractic care, consumer advocate, and consumer advocate is a program that helps us reduce our bills on average 50%. So if you have this component 1 and you don't, and you went to the hospital, you can use that consumer advocate to help you reduce your hospital bill. And there's also wellness and fitness information and a lot more. And employees can purchase this component on their own. They don't have to, you don't have to contribute. But we do have a second component that is for our upgrades, and we can go through that one next.
Okay. So, but I just want to take a moment here on the essentials. So you mentioned there's 3 different. So what they do, folks, is each individual can go to chcchealth.net and they can look at the plans that are available and they can enroll for those plans. Individuals If you're a business that wants to offer it, you can give your employees that address. Kate's available to consult with you to make sure, you know, that everything's fitting together well. And each one of these essential plans includes all of these additional benefits. So these benefits are with every essential plan. We're going to talk in a moment about upgrading the essential plans. But remember, when you upgrade, you keep all these benefits. These don't go away. Okay? So, Kate, you ready to go on to the upgrade with me?
All right.
All right, good. Kate and I kind of bounce off of each other, folks. So that's kind of our shtick. So kind of bear with us, you know. So, but hey, all right, Kate, you ready? Here we go.
All right.
So here we are with the optional upgrade. All righty, Kate. So there you go.
Yeah, so this is our program. Again, it's composed of 2 components, and this is component 2. It's our optional upgrade to Zion Medical Health Share. You keep all the benefits, like Ed mentioned, of the essential plans, which was in the previous slide. This plan covers high-cost inpatient services. So Zion Health provides an organized way to share in one another's medical burdens. Medical cost sharing is not a new concept. It has been in place for over 20 years. Everyone does get accepted to the plan, and there are 3 levels to choose from. There is no provider network as well for these plans. There's worldwide coverage, so you can utilize this coverage outside of the United States. And this is not insurance, it is medical health sharing through Zion Health. And it's for the unexpected high-cost medical events, such as your hospital charges or emergency room, a surgery, something like that. There is, however, a pre-existing restriction up to 2 years. So they do a look back of 2 years if you've had any medical need, such as a cancer, a heart attack, a stroke possibly. They do exclude that the first year in the plan. And then after that, they do start to contribute. But let's go back to those 3 levels, however. So they have 3 levels to choose from with Zion Health. And the levels, they are initial and shareable amounts, and they go by 1,000, 2,500, or 5,000. So those are the 3 types of plans that you can choose from. And with those levels, initial and shareable amounts, if you have a need, you pay that initial and shareable amount of, say, 1,000 if you choose that plan. And then Zion pays 100% thereafter. So there is no 60-40, 70-30, 80-20. After you pay your initial and shareable amount, Zion pays 100% for that need. And you have a max of 3 needs per year. If you should have a 4th need, a 5th need, or a 6th need, Zion pays 100% for those needs. So you only have 3 needs that you pay for in 1 year in that sense. And each employee can decide whether to upgrade or not. So you don't have to upgrade, as we keep mentioning. But to purchase this component, the employee or individual must purchase the essential plan first.
Okay, so now, we kind of understand that this is kind of a new way of thinking about what your health insurance is going to look like. And we understand that. So we just talked about the essentials, covering all the outpatient stuff and having all these additional benefits. And then we kind of throw another concept at you for an upgrade if you want to add it to help cover catastrophic or hospital charges. So what we'd like to do next is Kate's going to walk you through how it worked for one family. And on the website at chcchealth.net, there's a video that explains this family's story in a little bit more detail. So please, and there's a couple of other videos that are informative. So maybe after we're done here today, go to the website. But Kate, tell us about the Smiths. Well, today it's just the Smiths. We don't have the Jones. That's on the video. So I'm sorry, but tell us about the Smiths.
All right, so here is how it works. And here we have the Smith family, Pete, Louise, Junior, and Mandy. And Junior was outside playing with the dog and he got hurt. And so Pete takes Junior to the urgent care. And so Pete chose for the family the Choice Care Premium Plan, and we'll go through that plan in just a moment, plus the Zion 1000. And so because he chose that plan, he went to the urgent care, got x-rays, and then they had a follow-up to the primary on Monday. And then the primary suggested to see a specialist. All of that he had done using our Choice Care plan. Then that specialist decides that, you know what, Junior's going to need that surgery. So that's when we bring in the Zion Health. And again, they chose a Zion 1000, which is the initial unshareable amount. And here we have a breakdown of the plan of how it works. So here we have the trip to the urgent care using the Choice Care Plan card, and that is no deductible, and you have a $50 copay to your urgent care. Again, he needed x-rays done, so he had a $50 copay for the x-rays, again using the Choice Care and no deductible. Then he had a visit to his GP, and that is a $15 copay to see his doctor, his primary doctor, and that is a Choice Care in the Choice Care plan. Again, he had a visit to the specialist. It says 25, that is actually now 15, and it is in the Choice Care plan. So he was able to do a lot by using just the Choice Care plan and being able to access care. But now the specialist said, well, you need surgery. So we use Zion now. And so the Pete, the father, paid $1,000 for the initial unshareable amount for the surgery. And then Zion paid 100% thereafter for therapy that the child may need for 6 weeks, or a follow-up specialist appointment, removal of the cast, any of that need, all done 100% by Zion. So at the bottom, we have a total. And this total is if you did not have any health insurance coverage in place, it would come to 20,000, just over 20,000. Okay, but in our plan, because he did have the Choice Care Premium in place and the Zion 1000, it came to $1,140. So that was a significant difference, and we will also kind of show you that difference when it comes to a marketplace plan as well.
So if you do go to the website after today and you watch the video, you'll see how that 1,140 price tag compares to another family that had a marketplace plan. I believe they have a marketplace gold plan. I'm not sure, I can't remember exactly, but you'll get a counterpoint. The video is only about 5 minutes long. It's not an all afternoon trip. But, you know, it kind of shows you, because again, we understand these are some new concepts. Let me just point out that even without the Zion upgrade, the Choice Care would take care of the urgent care, the x-rays, the GP, the specialist, okay? And then we negotiate for you and we usually reduce these bills by 50% with or without the Zion. The Zion is just to give you that additional peace of mind, right? And if there is, Kate mentioned the pre-existing, because we want everybody to be aware of it. We want everybody to know. But, you know, if you have questions about whether you have a pre-existing, it doesn't mean, first off, that other conditions are not covered, because they are. But, you know, if you have some questions, call Kate and we'll go through it with you, and we'll make sure that you're going to be covered one way or the other. All right. Okay, so Kate, let's look at this now. Let's get down to dollars and cents here, because what's the fun of learning all these new concepts if it doesn't save you money? That's what I always say. So, Kate, take us through chcchealth.net versus a marketplace plan real quick.
Sounds good. Okay, so here we have the Choice Care Premium and Zion 1000 versus your typical gold plan on the marketplace. Okay, and so with that gold plan, there's no deductible, so they have no deductible. With that outpatient copays, to see their primary doctor, it's $30 copay. Their specialist is $65, and their urgent care is $30. Their network, however, is narrow and local. And the inpatient benefit after deductible, of course, they have a out-of-pocket max that's not shown here, but is 80%. So there is, of course, no pre-existing in that gold plan. But then when we look over at the Choice Care Premium in Zion, yearly deductible for Choice Care, there is none. Zion Upgrade does have $1,000 per need, 3 needs max. But if you look at the outpatient copays, even versus a gold plan, you see our outpatient copays for doctor visits and specialists are considerably less. And you're paying a lot for that gold plan. And then in that network, you see we have extensive network, national, and no network in that Zion Upgrade. The benefit after you pay that IUA, should you have a hospital need, is 100%. The Zion pays 100%. And again, there's no pre-existing restrictions in Choice Care, but there is that Zion 2-year look back. So we do want to make sure, of course, that everybody is aware of that.
Okay.
And
But
then,
a couple of important points here, folks, is the network. If any of you have marketplace plans right now, you know about the narrow network. And because of those narrow networks, you know about the waits to see, and you know about the requirement of referrals to see specialists. All of that goes away with us. Okay, because the Choice Care for outpatient stuff is a huge national network. And we can compare the doctor's availability for you too before you sign up. And you can go to any hospital. If you have to go to the hospital, you can go to any hospital you want with Zion. You need to go to Stanford or UCLA, you go. There's no restrictions as to where you go. The second thing that's important.
being able to go to New York. Sorry, Ed.
No, go ahead, Kate.
I was just mentioning if somebody, yes, they can go to Stanford and UCLA, but they can also say if they wanted to see a specialist in New York or Florida, they could certainly do that as well.
Okay. And the second important point is that 100%. I mean, you know, even on the gold plan, much less the silver or a bronze plan. If you're in a bronze plan right now, and we're going to look at the comparison of what it costs you to belong to these programs in the next slide here. But even 80% after you pay all your deductibles and all your copays, they're still only going to pay 80%. Whereas our upgraded plans pay 100%. So those are considerations to take into account. Okay, I'm sorry. All right, Kate, we ready to move forward?
Yes.
Okay. So now here we get down to some dollars and cents. And I know that Kate really likes this slide, so I'm going to let her go right at it. There you go, Kate.
Okay, these rates are based off of last year, so they're not current for the marketplace. But we did enter these into Covered California as far as the age and the income is what you see for single 26, 33,000. That is what we entered into Covered California. And then next to that, we chose the Gold EPO plan because it must compared to our Choice Care Premium. And Zion 1000. And so with that, we have the monthly premium for that 26-year-old in that gold plan as $543. And so they did get a subsidy, and that is $127. So that, you know, they were able to get a subsidy. But when you look over to what it costs for our plan, you see that to be fully covered with the Zion 1000, it's $347. So to have your set copays of $15 to see your doctor and all of the added benefits in that Choice Care, and then being able to stop at just $1,000 for your need, you know, you're saving a lot in switching over for that 26-year-old. But if you go down to that family, you see a family, a 45-year-old family, and they have a 44-year-old spouse, 18-year-old daughter or son, and 14-year-old daughter or son. Well, you see their gold plan. Okay, their gold plan is over $2,800, right? They're only getting $82 in subsidy. And our plan to be fully covered, $887. Okay, that is a significant savings for that family. They are able to save by the third month. They've saved for their Zion, needs already by switching. So it's a huge savings. for those families you can see there, but also for that single, person as well, they're saving at least close to $300 depending on their income as well.
Right.
So there's a lot of differences there, and I know that's a lot of information to take in, but I can do, this is all, of course, regional is how the Cover California is done. There's different rates in different areas. So I can do more specific to your area based on your zip, and I can do a full plan comparison against our Choice Care premium. So just keep that in mind as we keep going.
Okay, so what you pay for a marketplace plan is based on your status, single, married, how old you are, and your income, because that'll determine what your subsidy is. And even though there's been a much ballyhooed increase in premiums, folks, there's still no comparison to what you're going to pay for coverage and in the benefits that you're going to receive. There's just no comparison. And remember those networks. And so, okay. Now here's another one that this is one of our actual clients. This is a small employer, 8 employees. And Kate, why don't you take it away on this one too for us?
Yes, so this is a client that we that joined about a year ago now, and when they joined, they had a small group plan for their employees, and they had a gold plan option. So here I did a comparison as far as what the rates were by age, and then against our Choice Care premium plans, and we saved them over $67,000 by them switching. As you can see, there's a big cost difference between just that 24-year-old, that top member, between that gold plan and that Choice Care plan. But then if you look down at that family, just like in that slide before even, there's over $2,400 they were paying for that gold plan. And now they're paying $887 to be in our plan. And so the other really great thing about this, though, not every employee did switch over. They did keep one employee on that other small group plan, and you can do that. But that other employee had some needs that other plan worked well for them, and that is fine. And we encourage that if you have that ability to do so. So you don't have to have just everybody come in. If you have a group plan currently, and you do have somebody that has a pre-existing that's not going to work for that Zion part for them, specifically, then they can stay on that, as this is, it's an individual plan. So they are able to do that.
Yeah,
And you can see
we can help facilitate that, right, Kate?
Yes, we certainly can. The monthly savings is over $5,000, and then again, that annual savings was over $67,000. So that, that helps. Maybe you need to hire more people. I mean, that helps adding a salary or just other things that you need for your business.
Well, what happened here, if I recall correctly, too, is that some employees that just had coverage for themselves were able to then cover their children and or their family. I think is
absolutely
part of it,
yes.
too. So I can't remember exactly what this employee, but we've had this employer through the COVID. We've had them for a couple of years now, haven't we, Kate?
Yeah, just over a year.
Yeah. Okay. Well, okay. All right. And then here's a slide regarding Cobra, which is still probably a big concern. We understand that the COVID threat is receding, and maybe now everybody's having trouble hiring employees. But Kate, why don't we go through Cobra?
Yeah, so if you do have any employees that you are having to lay off, or in the future that you may, have changes where there are layoffs, Cobra, this saves 70% off of most Cobra plans and Cover California as well. You have that 2% admin fee, with the Cobra. We don't do that to our plans. So what they pay as an employee, or that would be what they pay as an individual. So we don't add that 2% admin fee. But overall, as you can see where the arrows are pointing at the Cobra premium for $1,400, I mean, that is the, a family coverage, the bare bones type of family coverage, and that's the probably least expensive Cobra premium for a family. Whereas you can see they can have some sort of lifeline by saving half of that, and still having compliant coverage, because as in California, we do have to have coverage. So you're able to just get that offered to them at a much lower price, which could be a lifeline for them as well.
Okay. All right. So Kate, with that 30,000-foot view, and I apologize for the noise here, we actually do have some golf courses in Illinois, in Chicago, and I happened to be on one of them, and they chose this moment to do so apologize for the noise. But anyway, we're down toward the end here. And Kate, why don't you maybe tell the folks how to get in touch with you? And I really encourage anybody, if any part of this looks like it's interesting to you, give us a call and let's take a look at what we can do. But Kate?
Yes, so you can go to our website, again, www.chcchelp.net. We have so much information on there, videos, we have a knowledge base, resource page, and we also have a chat function, so you can chat with us from 10 to 4, Monday through Friday. If you have a question, just go ahead and just send us a quick little chat, and we will get back to you. You can also give me a call. My number is 844-344-7330, extension 708. And you can also email us directly at info@apogeehealth.solutions. I am available to, meet with you outside of this, of course, and do comparisons for you. Anything that you guys need, we're here to help you with.
So, and once again, just to wrap it up here, we want to thank the chambers and all of you folks for taking some time out of your day here and listening to us. And as Alex said, we're here to answer questions if there's any. And thank you all. Thank you all very much.
Thank you, Ed. Thank you, Katie. We do have some questions here. First one, a couple people asked about possibly getting the presentation. Ed, I don't know if that's possible, but I do know this and almost much more information is also on our website.
We can post the presentation, and I think Alex maybe mentioned that that this webinar was recorded, but we can post, just this presentation, and we will on the website.
Perfect.
Yes.
Perfect.
Absolutely.
And yes, this is being recorded. It'll probably be up on our California Hispanic Chambers of Commerce YouTube channel. You just type in California Hispanic Chambers of Commerce. You'll see us pop up there. You'll see our logo. Thank you, Ed, for having it on there. And it should be up there probably most likely tomorrow morning. Let me see. There's a few other questions here. Sylvia, actually, from the Antelope Valley Chamber, asked, what is considered a need?
Yes.
Oh, yes. So a need is you fell and broke your leg, your arm, you got in a car accident, you might have a diagnosis that comes up, a cancer diagnosis, all of those are considered needs that would be.
Right. So a need is any particular specific illness or injury. So if you are diagnosed, God forbid, with a bad disease, from the day you're diagnosed with that up until you're all good with that again, that's one need. So traditional deductibles, think of it as like, what triggers a deductible. We pay 100% of your need. If you break your leg, that's a need. Like the Smith boy broke his leg. So we pay from beginning to when you are all well and good. And you only pay for 3 needs a year. After that, then we pick it up. If it goes over 500, then Zion jumps in. So a need is a function of the Zion coverage.
Thank you, Ed. We do have one. This one might be more of an offline conversation because it's about taxes. If 1095As are sent out or 3895s. Ed, I don't know if you might be able to answer that.
I can answer the 1095 question. So by opting in as the employer, that's taken care of with the plan. So we don't produce those and send them out. We don't, but they are taken care of as you are opting into the plan. They are still sent to the IRS that you have coverage and all of that good stuff that we do have to be compliant.
Thank you, Katie. Next one from Ricardo. How do we verify our members? How do you verify the employees belong to our membership? Now, Ed, I know you have a way to do that for them.
Okay, so how do we verify that somebody that, well, because we on the enrollment forms require the name of their employer, the address, the phone number of the employer. And, you know, then we kind of check with the employer to make sure that this person is an employee of that employer. You know, so we will assign each employer an employer ID number, and we double check on at enrollment.
Yes, and also I think for a chamber side, Ed, I do know we have an RN too as well if somebody comes in as a member. I mean, the big thing is we know right away if they're a member of a chamber. If you're a member of a local chamber, you're a member of us here at the California Hispanic Chamber. And if you aren't sure or you're not 100%, you can call me here at 916-444-2221. That's the office number here. I'm membership services. If you say, hey, I'm part of, well, I'm part of the San Joaquin Hispanic Chamber of Commerce. Yes, they are a member of us. So if you are a member of them, you are available for this thing. Or Antelope Valley with Sylvia and them out there. So that's another one we can help you guys with. Another one, this one might be more on a personal level from Antonio. What will be the best plan option for a self-employed person who has a very small business without any workers? I don't know if that's more of a case-by-case basis, Catherine.
Yes, I would love to speak to you offline. Then I can help you and make sure that one of these plans does fit your needs.
Yeah,
we have
Antonio. Yeah, Antonio. I mean, that's something that you really kind of want to take an hour and speak with Kate. There's just really no way to answer that question without knowing more about you. And nobody wants to get that intrusive, but just try to, the big advantage to this whole program that the chambers offer to each of you that are members is you get to design, to some extent, get to design healthcare that not only fits your needs, your health status, but also fits your budget. I mean, having something that gets you in to see the doctor that you are comfortable seeing is very important. That's a great start, and we'll walk you through no matter what happens. So I really encourage you to take some time out and give Kate a call or email her, and let's talk and make sure that you get the best that fits Antonio. Okay, that's the idea of this program.
Thank you both. I do not see any more questions. So with that, we're 40 minutes. We're about 10 minutes ahead of schedule. Ladies and gentlemen, we thank you again for joining us here. And like I said, if you need any information, Ed, I don't know if you want to put back up. Oh, I see the info at Apogee right there at the bottom. Thank you. Contact Apogee. You can contact us here at the California Hispanic Chamber of Commerce as well. We're here Monday through Friday. We're back in office here at the chamber, so we are more than ready to help. We're excited that California is reopening, and we hope you all have a wonderful rest of your week and a great weekend. Thank you all so much.
Thanks, everybody.
Thank you, everyone.